You are watching the Doctalk show.
So it's been 3 weeks since Uganda imposed her lockdown on the country. So that means there's restricted movement of people, restricted movement of vehicles. People don't just move anyhow. Avoiding large crowds, large gatherings have been removed. Schools have been closed. So you might be wondering why the trouble of imposing a lockdown? What does a lockdown do to a country? So I want to ask our experts today the importance of having a lockdown and whether it actually works as compared to other countries. So I'll start with you, Dr. Idru. How effective is a lockdown? The first question. And why was the lockdown extended for an additional 3 weeks?
So the first thing is to understand the spread of this particular virus. An infected person may infect 2 or 3 people, and this is called its reproduction rate, that it is in its lifetime is more likely to infect at least 2 or up to 3 people. And the way to stop this spread, is to separate these people.
Okay.
So if we are seated here and I was infected, it's likely that the 2 of you may most likely get infected. But if you stayed on the other end of the house, he stayed the other end, most likely this virus will die with, and we don't move.
Interact with each
yes,
other.
we don't interact with each other. This virus is more likely to end with me.
With you who is
so
sick.
the main reason why this lockdown, including also the social distancing, is implemented is that we stop this action, that I am unable with my infection to infect another person.
You stay where you are.
We stay where we are
until you recover.
And 2, from the time I am infected, there are it takes, usually the symptoms develop 2 to 12 days after, and during this period I am more likely to spread this disease. But from the time the person is infected, within 2 to 5 days, that person can actually spread the disease, whether with or without symptoms. Now, because of this, we require at least 2 weeks from the time I am exposed to develop symptoms and spread this disease. So if this separation is maintained at least for 2 weeks, we are more likely to reduce the risk of this transmission. And that was the basis why initially the president put the first 2 weeks. But there were some people who got infected, others went to, who were in the community, they had contacts. So we needed another 2 weeks for the people who had gotten, who had been in contact.
Recently got infected.
Yes, who might have gotten infected in the community. There were contacts in the community, to allow them, if in any case, to allow to see whether they will develop this disease. And if they had disease, then we are able to trace their contacts, to quarantine and contain it within that location. And lastly, we needed at least another week to prepare the kind of things which the Director General has been talking about, to prepare the other health centers to be able to take up cases in the worst case scenario, but more importantly, to trace all the people who might have been in contact. So for this reason, an additional 2 weeks plus 7 days was put together, 3 weeks or 21 days was put together to do this.
So as we conclude now, let's just remind people of how they can prevent themselves from catching the corona. We've talked a lot about the distancing, social distancing, but there are other things we need to focus on. Maybe you could remind us, Dr. Mavesa.
So it's mainly the same interventions like wash your hands with soap and water for at least 20 seconds, or use a sanitizer which must have at least 80% alcohol. Wash your hands as regularly as possible. As you touch these surfaces like this, wash your hands. Stop handshaking. Stop hugging.
Like physical contact.
Physical contact.
Any kind of
physical contact, please avoid it. Okay. Social distancing, like you have said, at least 2 weeks, 2 meters apart. At least 2 meters apart. Stay at home, which we have already elaborated very well. And don't touch your face, the eyes, the ears, the mouth. I think this has also been explained very well. And don't spit in public. If you use your handkerchief or a tissue, throw it away. If you use a handkerchief, you should wash it and iron it with a hot iron.
And I think also coughing properly.
And coughing
Public.
properly.
Coughing or sneezing. Cover your mouth with a handkerchief or with your elbow, like this, or with a, I don't know, with a scarf or any cloth. But don't just release things into the atmosphere and put everyone at risk. Right?
Yes.
Is there anything else?
Yes, gloves, especially by the guards who are checking
The ascaris.
the ascaris, and we are quite concerned about this because they may feel that they are partly protected. Unfortunately, they may not be undertaking enough measures of the hand wash, and you cannot
have a glove,
yes, and you cannot sanitize the gloves because the gloves 80% alcohol will create holes into it. So it is not.
So meaning people should not use
the
gloves
are
in
not.
public.
They are not the right thing to do.
So what should people do?
And you can imagine, you may touch the doors of a vehicle, of one vehicle, or somebody's bags as you are touching it, and then you move it to the next one. Or rather, in between these contacts, either the person either wash their hands or use the sanitizers. The gloves are not a very good thing, and we're quite concerned about that. Two, we also see in the public there are some people who are especially picking either the surgical masks or the N95. The N95 are really very precious masks currently for us. There are very few in the country, all around the world. So as much as possible, we would like to discourage the public from using them so that they are available for our health workers to use in these treatment centers. Because in the health units, that is where the disease is concentrated, so that the few are available for the health workers. If, as members of the public, if you have to use masks, we will advise that you use instead the cloth masks.
The cloth masks.
Yes.
And I've seen a number of them on the streets. So that's what they should use.
Yes.
Not the real N95s, which are the protection for the health workers.
This for the health workers, and there are very few available currently. Right. Everybody around the world is going to the same places, and stocks are not enough.
Okay, they are the hotspots for the infection, so they need maximum protection there.
Yeah, absolutely.
In the health centers. Okay, so any final words, Dr. Maivesa?
I think I want to encourage the general public that let's work together, follow the guidelines that we have given, then we shall bring this problem under control. As you see, the rise is really not very high because people have followed the instructions and the guidelines. So I want to reassure them that the situation is under control. I want to assure our health workers that we are doing everything possible to assist them, to provide them with the relevant equipment, and to provide them with the relevant medicines where appropriate. I also want to encourage, and I think, I need to emphasize this, I want to encourage the people who returned from outside the country between 7th and 22nd. I've been uncomfortable with some of our messages which I've been reading on TV and whatnot, where they were saying Ministry of Health is hunting for people who returned from abroad. I want to assure the people that we are not hunting for people who returned from abroad. We are only encouraging them to come out and discuss with us. Those we find have any signs and symptoms, we help them. We are not going to quarantine anybody. If we find somebody sick, we shall take for treatment. But we are not quarantining anybody. So people should not look at it.
To come for testing.
Yes, we are
encouraging them to come
for
from
abroad between 7th and 22nd when the airport of March. When the airport was closed.
No, they contact us and we shall come to them.
We contact us and then we shall come there to help. They shouldn't come out, but we are not hunting for them. That's what I wanted to emphasize.
All right.
Because that kind of message has been going around.
And it scares people.
And it scares people.
You're hunting, what are you going to do?
Yeah, why are you hunting me? And then you are going to quarantine me, you are going to... Yeah, we are not doing that.
Okay, so Dr. Edru, any last words?
Yes, please. 2 last words. One, I would like to thank all the health workers for the diligence during these difficult times, for maintaining to run the service, and for the public for really listening to the words which the Ministry of Health has been communicating, which the President has been communicating clearly. And for those who have additional, who have other diseases, especially the chronic diseases, please try to get into in contact with your nearest health center. If you have high blood pressure, remember that you need to continue taking your medicine. If you have diabetes, asthma, epilepsy, you need to continue taking your medicine. Pregnant women, we need, especially those 6 months or more, we need you to attend antenatal clinics, try to get in contact with your health centers, and let children who are supposed to get immunization, please, we don't want to break the immunization circles. We don't want diseases coming back because of COVID. We need everybody immunized, and pregnant women attended to, and please get in contact with the health units, and those around Kampala metropolitan area, KCCA has numbers, and they can even come and pick you or bring for you medicine wherever you are. And similar, the DHOs are organizing similar things for the different districts around the country.
Okay.
But to emphasize on what he has also said, our health centers are not under lockdown. Our health centers are still working, so services should continue normally. And we encourage our health workers to continue treating the usual cases. Before COVID came, all those services must continue normally.
All right. So if you're at home, you've heard it from the wise men. If you're at home and you have additional illnesses apart from COVID, do not stop taking your medicines. Find a way to get yourself to the hospital and receive your medication. If you cannot call either a colleague or a health worker to help, deliver the medicines to you. If you live within Kampala metropolitan area, the KCC is going to help you do this. If you live within the district, our districts outside Kampala, the district health officers, I think they're called DHOs.
Yes.
Yes, they will help you receive your medication. So with this, we can fight corona together. We just have to remain calm, listen to what the good doctors are telling you, and make sure you stay safe in your homes and take care of everyone around you. I want to thank our Director General, Dr. Mubesa Henry, for the leadership spearheading the corona fight and steering the country towards eliminating the coronavirus from Uganda. And also want to appreciate the President of the Ghana Medical Association, Dr. Idro Richard, for coming out and educating the public on fighting corona. So we'll see you again next time on the Doctalk Show. If you have any questions regarding the coronavirus, our lines are open, our social media pages are open. Reach out to us, we shall answer each and every question you have regarding corona. Till next time, we'll see you on the Doctalk Show.